building resilience for a new future. And in a world, I would like to share first the experience that friendship has been having over the last 20 years in dealing with catastrophes, not only once in a while, but annually. And we have had this. I started, in communities where we are in a country where we see disasters happening, not only natural disasters that happen, cyclones, floods, sometimes famines, land breaks, erosion. And in 2017, we started off with the Rohingya crisis, which was totally different from any other disasters which we had handled before. And the communities in Bangladesh, the areas that we work in, how have they managed, not only, how do they manage, these climate migrants? Because every time there's a climate crisis, they have to move. And we have been handling millions of these climate migrants, over the last 20 years. What is it that they have in them, this amazing resilience that they have in coping up with their life over and over again? I would like to share this with you because I think beyond friendship's commitment to working with them, we've also been able to imbue in them one very important element, which is, without which I say that nothing they could not have been, they would not be sustainable in their resilience if you did not imbue in them dignity and hope every time we touch their lives. So 20 years ago, when I was sailing on the river Brahmaputra, I saw communities, climate migrants who would lose everything annually. They had no access to the basic platform which was so needed for building life. And when I saw this, and I felt that, they were living in a situation where in areas where, forget about having electricity, they hardly had land, their lands would break. They hardly had access to any essential services on which they would be able to build a platform from which they could take off economically or socially. And I remember going there and sailing on these rivers, and seeing that it was impossible that I could leave them behind and not do anything. When you realize that there is a little scope of doing something, you start. So in 2002, I started with the first mobile ship hospitals. This was to take healthcare to them, because health for me, saving lives for friendship, is the primary target. And there we started off with saving lives, which is hospital ships. We built a 3-tier healthcare system, and which is hospitals. And then we had community, we have about 18 clinics. So 4 hospitals, 18 clinics, about 560 community satellite clinics, and then also about 650 community Medicaids, all linked through a chain of services of mHealth. I soon realized that just saving lives was not enough, would not give them the platform that they needed. So what we started doing was, of course, we had to deal with climate every few months, climate disasters which were happening. So we had to work with building their capacity, preparing them for the coming disasters which would happen, climate impacts, preparing them for housing, helping them, with relief work, housing, rehabilitation program, water sanitation. And that was not enough, because then they needed livelihood. And livelihood could only come when we would help them get trained for earning income in whatever capacity they had. And that is what we started doing, providing access to finance and training them. But at the end of the day, they needed empowerment to be able to stand on their feet. And today we have, so we started our inclusive citizenship program to link them to the mainstream government, and also to link them to the legal system, the legal aid in the communities, legal aid with the government. And we have about 75 of these paralegals now working on issues like child marriage, etc. And, and year after year, we had to adapt, we had to innovate, we had to learn, and then we could implement. And it is only by working with the community, directly understanding their needs, listening to what they say, listening even more deeply to what they don't say, that we were able to ensure that when we left them behind, they had the capacity of standing on their feet. And so today, sharing a bit of the friendship program, I will show you a little video, about 4 minutes. And after that, we have William Lebedel, who is our chairman of Friendship France, who will speak on our organizational model of friendship and how we work. And I think it's quite an efficient model on the way that we are working, South-North partnerships, and truly as a global team. And I think this makes the whole program, the whole organization more effective. So we work in 4 main sectors, which is saving lives. It's climate adaptation, which we have to do a few times every year. It's poverty alleviation, and of course, it's empowerment. But how we manage is not by implementing only programs, but the common link is the values on which and the way that we work, the deeply integrated. It is ensuring that we have our 5 values, which is integrity, dignity, justice, quality, hope. And that is actually the pivot on which we work, and ensuring that the people, when we leave them, they are left with dignity and hope. So, thank you, and we will share our video.
Bruna, I think you're on mute. Yeah.
Yes. Thank you, William. Would you like to say something about friendship?
I mean, the one message I want to share with you is quite simple. If we as an NGO or as sponsor, maybe around the table, or supporters are not the change maker. I think the message is the people are the change maker. And because the people are the change maker, that makes dignity the most precious and powerful lever for change. So in a nutshell, that is my takeaway. But let me come back to my story. I'm an entrepreneur. And I set up my company in 2011. The same year, I decided to start working with Friendship. As you can imagine, as an entrepreneur setting up his business, my most precious thing is time. So how do I manage time? And the key question for me was, is it worth spending some time with Friendship? And you already know the answer. The answer is yes. The question is, why is it worth spending time? Let me go through 4 ideas. First one is the call for action. I mean, when you see deep injustice, you have to act. I mean, each of us are responsible to take action on this. And when you're born in a country such as Bangladesh, well, maybe the feel of injustice is even stronger, because this is the country facing probably the most pressing challenges of humanity. Should it be on social dimension, economic dimension, and climate change. So the sense of injustice can be even stronger there. And if in that country you go into remote areas where you do not have any access to any of the vital needs, so that feel of injustice is a strong call for action. So the second point is, okay, so from there, what do you do and how do you do it? The problem when you come from a country from Europe, like me in France, is that in fact you are very far away from the communities. You are very far away from understanding the reality of the needs. So how do you close the gap? How do you close this gap to better understand what are the needs? And this is where the Friendship model comes in. Inclusiveness is not a word, is a reality in this model. And I'll give you maybe 2 figures and 1 story. Figures: half of our staff are recruited within the community. We have 3,000 people within Friendship. Half of them are recruited within the community. So inclusiveness and working with the community is not a word, it's just a strong reality. The other figures is 100%. 100% of our program are co-designed with the communities. We don't work for the communities, we work with them. They co-design each of our program. And so what's the Western world called the localization model is in fact a deep reality in this model. The other element is the fact that the quality is not negotiable. Excellence in execution is a must. It's a no-brainer. Building some poor quality latrines will not change behavior in terms of hygiene, because it will not support floods or cyclone that we have every year. So quality is not an option. It's just, if you want to make change, you need the quality. And that, I think, again, is a no-brainer. And this is what in the model makes it so powerful, that you need this level of quality if you want change. Now, probably I would say the most important reason why I decided to join a Friendship is the idea of dignity for change. Because you can have beautiful infrastructure, you can have a beautiful clinic, but you may have nobody coming in. So the question is, how do you build the trust so that people effectively come into the clinic? What will make this woman come into and accept that you do an injection? And this is not about the technical quality of the infrastructure. It's about behavior. And I saw in the Rohingya camps, I saw so many beautiful infrastructure, nobody inside. So the difference is not only on the technical aspect, but it's hybriding the technical quality and execution and the behavior. How do you build trust that people will effectively come to you, will accept that you work with them? And this is where there's one critical question is, how do you make sure you give more than what you take? What is the way that you are going to help people so that you will not pull them down, but bring them up? You've seen some few pictures about empowerment. And I think this is at the core. How do you make sure people will reinforce more and more their own resilience, their own dignity? Because they are the change maker. You are not. You are just here to bring an infrastructure. But the way you're going to do it, how you're going to fuel your spirit and your value with it, this is what will make the difference. And depending on how strong you will have a community being and reinforcing this, the better the system change you will have. So I think this is, for me, the strongest takeaway is how do you reinforce the dignity of the people, because they are the change maker. And none of us are the change maker, it's them. The question for us is how do we help this happen? And I mean, the real challenge for us now is what? I mean, we're all facing climate change and it's accelerating. And the issue for us is we need to gain discourse. We need the community's resilience to be stronger and stronger and more quicker than the climate change is accelerating. So this is the challenge that we have, and for this we need to reinforce their dignity. I think that is, for me, key. I mean, and Runa, I know you will come back on this, but what happened the last few weeks? We will talk about COVID. What happened in Bangladesh? You had to face COVID plus a cyclone. This is the reality. So this is where the question of resilience is totally linked with the question of dignity and the capacity of the people to behave, to be autonomous. And for us as supporter, the question is, when do we withdraw? How do we make sure they take over their life? So to come back to my question of time, which I started with, I initially thought I would, sort of invest 10% of my time to bring some change. I'm afraid to say it might be 25% of my time today, which is quite a challenge. But if I do so, it's because also I'm as an entrepreneur, I'm inspired every day. And this is the cherry on the cake, and it's quite unexpected. I think I'm helping, but actually I'm being inspired every day by these communities, their resilience, their dignity. It's a lesson. And we see with the COVID that the only response is through solidarity and through values and through cooperation. And this is what we learn from this community. And this probably explains why I'm spending 1/4 of my time on friendship. But yeah, so these are probably the main reason why me and probably some of you are thinking how to act. But I'm sure you will now. You want to come back on how we dealt with those cyclone and COVID issue within this model.
Thank you, William. So it was not only cyclone and COVID, it was also the livelihood issues. Bangladesh is a country which is 170 million people and one of the poorest in the world. So you can understand one day of not having income means you can't feed your family the next morning. And when this COVID came in, this was by end of February, though the government, and we had not had declared any deaths by then, nor had it been an emergency, but friendship needed to be prepared. We have 4 hospitals, 18 clinics, which needed to be on 24 hours, because we are in areas where if you don't give the family planning tools, you have a baby. So we at EPI, there's no one else, for immunization. We had to continue. There was no two-way about it. So we needed to ensure that first, for me, the first was, I remember telling our people that I have to ensure that in this crisis, which is for sure going to last years, no one must lose their jobs. And to ensure that was not easy, which means we had to reshuffle the whole organization in a way where we could still continue the work. Security, safety, protection of the staff was primary. We have about 3,000 staff in the field, and they needed to be protected if we are going to give any sort of delivery to the community. And not only friendship office means friendship office with few hundred people and 40 offices regionally. So all that needed to be, we needed to address every single one, because I didn't want anyone to fall through this gap of getting sick, as far as we could do. So right in the beginning, even before the government had declared the emergency, we had procured a lot of PPEs. We ensured that all our offices had distances, work from home possibilities, ensured, of course, cleaning, hygiene, all this, including the back office support, which Qazi Amdadul Haq from our side will tell you about. So one of the things that we tried to do was, for the first few days, the enormity of the problem in Bangladesh was, you look out of your window and you see a slum, there are thousands of people. There are many countries like this, but certainly Bangladesh, is actually the most populated country in the world beside the city-states. So it was hopeless in a sense. We did not know whether we had to be secured ourselves or ensure that food reached people all around your homes. So you are living in a nice home, but there are people all around on the road who had not eaten for a day, 2 days, even in the cities. And so the first thing was protecting our people, ensuring food, at least, in the city and out of the city. Second was, we needed to provide some kind of protection. Masks were not available. By the time that the government declared the emergency, it was very lucky that Friendship had prepared, ensuring a 3-month supply, but of medicines, etc. And also for all our staff, we gave immune boosters, etc. And at that time, there was enough in the market. And we had a 3-month stock, but then we needed to ensure our beneficiaries' safeties. And what we did was, we have an enterprise, Friendship Enterprise, which is called Nodi, and we started making masks, cotton mask, reusable, washable, 3 to 4 layers, depending on who's using it. And we started putting this through boats, giving it to the community so the communities could earn some money and start making masks. And today, we have already done more than 100,000, all getting distributed, including cotton gowns for safety measures. Then we move on to health. Health, we could not afford to keep anything closed for even a day. And that was reality. And it was incredibly difficult. Can you imagine how it was in the Rohingya camps? With our staff, we were seeing hundreds of patients a day. Friendship sees more than 350,000 patients a month on just health. And, with about 6.5 million people a year through different services, double that for Impact or even more. And we needed to ensure all this was still happening and we could continue the service. And in spite of the lockdowns, then, we needed to, so we prepared our office structure in a way that we could work virtually and at the field, because we have about 50% of our staff from the community, they could continue work with safety precautions. And so health continued. We also, then of course, there was a lot of relief work that needed to be done, food relief. We went on into our education program and we revamped it. We have online schools, and we used to have ICT-based, internet-based schools. And this was something that our communities were prepared for because they were using it, because we never have good teachers in these remote areas. So that, because we had the lessons already recorded, more than 2,000 lessons, for between grade 6 to grade 10, those then were taken over by the government, and we launched our own YouTube, linked to the government YouTube, the government YouTube channel, and also the national television started showing our recorded classes. And we ensured one little change. We ensured that dignity was part of the whole curriculum. So every lesson was ended with a message of dignity and linked to that particular lesson of that day. Livelihood programs, we could not let our farmers not have the crop, not have the seeds on time. We could not, not give them the money to get the seeds, ensure that food was reaching them. And these are remote islands which would take hours to go by boat. So we started a system of online training and online work with our communities. And I would say the total amount of trainings and programs that we have done, from health to all our empowerment program, would run into hundreds of thousands of telephone calls and online trainings that we have done one-to-one and even within groups for farmers. And but this was, again, we needed to, domestic violence was up. Suddenly we realized that in these villages, child marriages was one after the other. Parents were trying to marry their children off, girls of 12, girls of 13, within days, last 3 months. And within a month, we realized this, and we had to take actions against this. And immediately we started working with the legal aid system of the government, etc. Then we went on, and this was whilst handling this, and this was all from March, April, May, and June that we did this. And it has been quite an effort. And I really am amazed at the way that 97% of our staff have all been working from home, in the fields, fully geared. And we also had, the legal system needed also to be connected to these remote areas. And this was really a challenge. So as a result, what has happened, as we were really on the field, we had built that preparedness for communities to be able to take off by themselves. And this is extremely important, because if we had not done that, then the government would not be able to reach hundreds of thousands of people in these remote areas. They are all being reached through the Friendship Community Medic Aids, the Friendship Paralegals, who actually has been linked directly to the district courts now. It's unheard of. It's the first time this has happened. But they can directly access the legal courts in the districts. And we have worked with the government, even for 50% of the collection for samples have been done with the government by Friendship in the areas that we work in this country. And we are, of course, trying to put up some, now we are hoping that we will be able to put up 2 field hospitals, which with about 50 to 100 beds each, actually 3, within the next coming months. And also, which we are still awaiting the donor consent, but we have it already. And I think what has been the main strength is that Friendship has managed to continuously reach the community in this crisis. And this has brought respect and confidence. And they know that if something happens, they themselves are equipped, or their community is equipped to reach those that who need to be reached. And this has been, I would say that this confidence, it comes, for me, it's dignity, that we have been able to imbue dignity, that people can stand on their feet. So I'll show you a little video. It's a 3-minute video of some of our work. Amdad, I would like to, I want to introduce Qazi Amdadul Haq, who is our Director for Strategic Plan. And he would explain also perhaps in a way how we could manage, to work as we did. And but this has been, I think, one of the main things have been that it's preparedness, not only for the community, but also for the organization. And second, of course, is imbuing dignity and hope, as I've mentioned. Amdad, please.
Good morning, friends from Europe, and here is in afternoon. And I'm really happy to share with you. You just listening the vibration of friendship countrywide. And beyond this vibration, there are some enthusiastic people and who has lots of commitment. So that I will explain you how it works behind the scene. And friendship from its very beginning is very much focused for its work with quality and efficiency. We have our strategic plan and it's very much online, and strategic planning tool actually keep us focused and efficient. In case of any emergency, we revisit our strategic plan and we reconfirm the target and our ambition is well defined with the context. And considering this situation, even for COVID, we immediately revisited our strategic plan and we reworked and we identified what are the activities need to be modified and what activities need to be reworked. And then accordingly, we develop our strategic plan. And not only the strategic plan, and we clearly define our actions and under each and every goals, targets, and time frame. And that helps each and every work very much in line with our goals, and any members of the organization can have access to this strategic plan to know how his or her contribution, bringing impact in the life of people who is really beyond the advantage. And beyond this strategic plan, we also prepare our each and every staff's orientation, how to cope up with the strategic plan, because strategic plan is attached with the government focus and other priorities. And then to implement, to take forward this strategic plan, our soldier are our team members, our human resources. And in the beginning of COVID, we again reconfirm the health status of our human resources, just to make sure, because we can't compromise with their quality of work. If they are sick, it's really unbearable, because there are many remotest communities depending only on friendship. So we made sure 24 hours call center for our colleagues in case of any need. We introduced the virtual meeting monitoring provision, and at the same time, everyone prepared individual work plan. It's not only task, also some development issue, some update issue, documentation issue incorporated considering the situation. So not only these figures, what I mentioned here, beyond that, there are plenty other things, orientation, mentoring, coaching is going on for our human resources. And to make sure these human resources are safe, as you just learned, that our office arrangement, we reorganize to maintain social distance, introduce hand washing point, we screening everyone in our premises, maintaining, consultation, keeping distance. And at the same time, all our facilities, our administration had to reorganize to enable facilities and our vehicle movement, everything. And for each and everything, every steps, entering office, vehicle movement, we need police clearance. And now you see the lockdown Dhaka. Dhaka is really under lockdown since its beginning, but our food has to reach our people in need. So that is a truck going to the community where you work. It's 7-hour journey, and then the boat has to take to the people. Our finance and partnership development team need to keep uninterrupted services, but bank closed. The NGO bureau, whereas we need to approval, that also closed. But we need to negotiate, we need to manage to make sure our finance flow is continuing, and our partnership development team keeping contact with the donors to make sure the support are really enable people to keep in this crisis situation. And not only these things, we had to reorganize for so many programs. So our Beyond Finance teams, our application team, working with the finance to make sure that all the activities are in track and all the activities are quite managed well. And so this circle, what you just notice in the screen, has to follow each and every moment for a new project. This is our brilliant application team created the YouTube channel because children are locked at home. So, and our research team continuing periodic research to know what we are responding is in need and to sure the impact are okay, so that we redefine periodically our work. Not there actually, but to keep people updated, to keep connected with the stakeholders, our communication team doing simultaneously the leaflet, the post in the social media, and also producing bulletin and news media covering our program. Friendship keeps hospitals, clinics open for serving marginalized. These are the headline of newspaper and different media. So that actually made us enthusiastic, and we keep continuing our work. This is one of the swing centers. Several swing centers working for a mosque. And when I'm showing this, I can't stop saying the story of Sakina. Sakina, a lady who had to leave work during immediate entering COVID with €4 only in her hand. And she knew the mask can prevent the coronavirus. The 4 member in the family, but she can't afford 4 masks. She could afford only 2 masks, and she made sure she wanted to make sure her 2 child is protected. She and her husband remained without masks. When she got the relief bag from Friendship, immediately she noticed there are 4 masks in the relief bag. Immediately she grabbed a mask and she covered her face, and she got out from the home, and she was like cheering like anything. I am now protected. I am now protected. And this little mask is a 4 mask cost of €1. This little mask, I don't know how can I explain you the happiness I saw in her face and is in her vibration. And this is the reason behind our enthusiasm. This is the reason behind Friendship to continue work for a good thing, for a good reason. And we want to make sure in the up to last miles, we'll keep continue our work with our commitment and dedication with all your support. Thank you so much.
Thank you, Amdad. So, over the last 3-4 months, we have managed to reach about 1.2 million people with awareness, and we've been continuing our services. But it's the first time the world is with us for a disaster. This disaster is a reality of friendship, which we see several times a year. And today, we are able to share this with all of you because all of our lives are touched. What can we do to have a more equitable world? What can we do to have a world which is not impacted by climate change, which falls on countries like ours all the time, several times a year we see this. We need to work with so much more respect. Respect not only for people, not only for humanity, but respect for the trees, the plants, the climate. And if we don't respect the climate, today we are having a healthcare issue which is all around the world. Tomorrow is going to be climate, and climate is our reality for the last 20 years. We have been having this. So I hope we can bring it up to you, all of you who are part of this program today, that we need a more equitable world. We need a world of better distribution of resources. We need a more respectful world, where the haves, the have-nots, the powerful, the non-powerful can meet on a plane where this kind of an impact doesn't touch our lives in this manner. So thank you very much. Thank you for joining us. And if there's any question, you can either put it on chat or of course you can ask. Sabur would be managing that. Thank you very much. Thank you. So if there's any questions, Sabur?
We don't see any question from anyone yet. We still have some time if you'd like to.
few minutes, 7-8 minutes for some questions. Any one of us can answer, Amdad or William or myself or Sabur, we could answer the questions.
You can directly type the question. There is some appreciation for the session. Or if you'd like to ask your question, just unmute.
Compliments. You can read.
Okay. We were that clear? That's great. Okay. So, William, is there anything more you'd like to share? Or Amdad, you'd like to share?
Maybe one element on my side. In our sector, we often talk about the localized model, and I think we have in Friendship this model where each of the entities around the world are promoting this localized model. It's a way to reduce the link between supporters and sponsors and the beneficiary. We do think there is a space for this to grow, to work a bit differently with the beneficiary, not with a donor need, but more with the beneficiary needs driven. And I think what we saw from all the action has to be very reactive, very quick, and this can only be at the field level where you need to be so quick and efficient. And I saw some few questions coming up now. Maybe Sabur, you want to raise one of them?
Yeah, I think the first one is Vivian Langford would like to know that, who can I interview from climate program on Australian radio? We will be in touch with you. You can either send us an email, or we will be in touch with you on this regard. Thank you very much. The next one is from Lilitan. What are some of the ways friendship has affected your perception of the possibility of world change or a more equitable world? What are some of the ways friendship has affected your perception of the possibility of world change or a more equitable world? Can anybody would like to answer this?
Sorry. Would any of you like to answer, or then otherwise?
I think, Appa, the way you're taking forward the vision with that critical situation, and it's not really COVID. Beyond COVID, the area we work is really detached from the mainstream. And you can share your challenges and the confidence, what made you that much inspired with 3,000 people. So you can tell this.
Yes, I think it's, well, for me, I think the people who are supporting Friendship, we have about 3,000 staff, and we have an international community which is supporting. And the way that we have a new kind of a model. We started in the South, and then I did not want to be locked with the only donor fundings who had specific projects, because for me, it was extremely important to work with needs-based, filling in the gaps in the community. And I think this has been one of our strengths, that the people realize, those who are linked with Friendship, the donors who are linked with Friendship, realize that we work in a model where needs of the community are addressed because we fill in gaps. So there's a synergetic effect. I just give you an example and I think this is what motivates not only the staff, because you want to see, when you do an action, you spend your life, you give your life for something, you want to see something happening. You just don't want it to be a statistics in a manual. And I think because they see this happening, this is what keeps the motivation. And for the world of tomorrow, I would say, we do so many awareness programs. We do so many, so much of meeting each other and contacts and services. However, at the end of the day, somebody has to pick up the dirt on the floor. You know, you have to put your foot on the mud, and you have to actually give that woman who is suffering, you have to give her that operation. You have to ensure that child is going to school, and you have to ensure it not only for today, you have to ensure it that you do it in a way where they can continue this without your interference again. And I think this has been, I think, because we build routes, we don't build programs. We ensure that with each program, the roots are so strong that the program stops, but the people can stand. And I think this is what needs to be done more and more, you know, more and more for everything. We can have, you know, we can have a lot of ITs, and we can have this new kind of virtual things happening, and beautiful, you know, world changing things. But at the end of the day, you have to reach that food to the hungry. You know, who is going to do that? You have to ensure that. And this balance needs to be done. You cannot just sit in an office or in your home and think that just by gathering people together on screen, that things will happen. Things will happen when you have the courage of putting on that gown and going to the field and ensuring that it's happening. So there is this, more and more people will have to realize, if you are going to make an equitable world, you need to bring everybody up with you.
To build on this, maybe just one short comment. I think the enthusiasm of the youth joining Friendship one way or another, should it be in Bangladesh or in our office across Europe, is a strong signal that you need meaningful life and you want to have impacts in a world that needs to change. The other, and I saw Stephanie around us today from Sanofi, we have more and more partners that they don't want just to, you know, support us financially. They want to see the change. They want to see the local change. They want to open the network to us so that we can have a stronger impact. And we see more and more attractiveness for this model, which is not an easy one to understand. And I think, yeah, we see a more equitable world with the attraction that we get from partners, from people willing to join. I saw some question, Runa, on the how do we cooperate with policy and government? What was the challenge on the ground? I think that was a good question.
Yes. Okay, in a country like Bangladesh, many of us are in countries like Bangladesh, where the policies keep changing hourly sometimes, you know, because you know, it's a poor country. Our management of the whole country is not as it's in Germany or France or in Europe or the US. So it's difficult. And the thing that we did was we are working directly with more than 25 different government entities simultaneously. And it has been an incredible challenge. But what we had to do was to foresee. Because the government makes decisions when they get an order. But as an organization, because we had foreseen this was going to happen in end of February, our staff in health started contacting the government for permits to work in the beginning of March, when the lockdown had not happened. So they already knew us. For the cyclone, we had been in the front line with all the government meetings, with the international community meeting, and mainly the government disaster ministries. At the field level, the jails, the local offices, the district commissioners' offices. I mean, at one point we were, because there was not many presence of many organizations. So of course there were people were there, but you know, so we were actually working. There are cases when we have desks in the government offices coordinating with the government their movements for the field where we are, and this has happened today. In the beginning, I will tell you, it was extremely difficult because we could not start from the top. From the top, they can say yes, yes, yes. Minister can say yes, yes, yes. Of course, it does work. They give the overall umbrella of credibility to the organization. Otherwise, nothing will happen. That is there. However, you need to work at the field level, right from the smallest institution of the government from the field. And if they bring up the need to the ministry, then it gets stronger. For example, our code of ethics and dignity that we teach, we started working not from the ministry in Dhaka or in the capital, but we started working with, I don't know, now there are a few hundred schools, government schools, which are keeping half an hour open for friendship people after the school closes on the weekend, for the weekend, to teach the code of ethics. So now, because the field is agreeing, the local districts are agreeing, now the government took it up quite easily to ensure that this one page for the code of ethics goes into the national channels and the government YouTube's channels. So I think it's a question of getting the credibility by going to the ministry, but actually the real credibility, the minister will say yes only when you have field work coming up. Otherwise, though there is all the goodwill of the ministry, things don't move. So you have to start from the bottom. This is an experience we have found.
I see the timing, we're getting close to the end. There's one question about Rohingya. What's our engagement? Maybe I can give, we were there right from the beginning, one of the first NGO possibly active there and still there while the number of NGOs is significantly reducing with a huge program on health. And we have 200 team there every day, almost. So maybe one word on the COVID situation in the Rohingya camp, I think would respond to François de la Vison question. Runa or Kazi, what is the situation in terms of coronavirus within the camps right now? And we have 1 minute, but
yeah. So within the camp, you know, in the beginning, you can understand the density of population. So in the beginning, people were not even coming to the healthcare centers. They were so scared. 1 or 2 or 3 patients from, you know, up of about, you know, 1 or 200. You were getting 1 or 2 per clinic. And now it has started, and people are incredibly frightened. Of course, you know, Bangladesh's statistics of nearly 100,000 people is 90,000 something plus people. It is not the reality really, because we don't really have the testing kits, the units. So we cannot tell you figures in the Rohingya camps, but there are FFTs, and we neither have testing kits enough, nor do we have enough curative measures to take, like ventilators. So we are scared. I think not only we are scared, we are very scared. And all we can do is ensure that they get their immune boosters and good foods, you know, ensure that they are eating regularly, because I don't, it's scary if it spreads. Amdad, you want to add something to it? You're on mute.
There are some, I better reply some question related to how really we are addressing climate resilience issues during COVID situation. We actually, in a nutshell, if I can get chance to explain detail, I'll tell later. That is, we reorganize our modality of work. For example, we don't organize the group work at this moment. We go doorstep level to explain how to reinforce the house, how to save life, what to protect and what to prevent, what to store, so that the work hour and modality of work has changed dramatically. And this is the things, and rather conducting training session, we produce pictorial materials as a guiding tool to help people in this flood situation or cyclone situation, what to do, what not to do, how to prevent, how to protect. And at the same time, we blended the emergency response messages with our COVID messages. This is the in a very nutshell. I
And I would
explained.
just add something that for example, when the cyclone Ampan had struck, before that, we took the measure. And this is what is very important. We took measures in our community. So the areas that the cyclone had struck, the damages were 16%. Okay, in the district. Areas in which Friendship works, it was over 19%. But the communities in which, this is district-wise, communities in which Friendship worked, the damage was 8%. So you see how preparedness helped. The houses did not go away. We had, I think, only one house which we had addressed, which was damaged. Otherwise, none of the houses we had addressed were damaged. And this is why one needs to build roots much before this can happen. And for the world of tomorrow, this is one calamity we are all having in common. But how perhaps we have adapted is we have learned that preparedness, deep preparedness from imbuing dignity, respect, and the ability to stand on their feet, right up to actual going to the field and preparing the people physically in health, in giving resources, in knowing where to go when problem starts. You know, building this builds resilience. So
Immediate after the COVID situation, till now, more than 100,000 phone call we made to our beneficiaries, actually just to make sure not only they're giving advice all the time, just to let them know we are here for you. And so that contact build them, actually give them confidence. So this is the way we keep continuing our work.
We have a few more questions coming in, and we also actually time is over. I'll very quickly read another question. Is that, do we have any plan to involve more women in our health sector after the COVID situation?
Friendships, actually, we have about 80% of everything that we do is women. So women are an you know, from healthcare to education. Even in a country like ours, 55% of all our children are girls. In the field, all our paramedics, most of our paralegal aides, you know, we involve a lot of women, but women, because women really are the strengths in Bangladesh. I tell you, we have very, very strong women. And it's because of them that we can move ahead so fast, also because we involve them so deeply. And certainly there's always an opportunity to do more because they need more help than the men, of course. So yes, from empowerment to education to everything, yes, we will look into more work, of course.
Next question is about, and the people with disabilities all are equally actually respected in our program and taking part in giving decision.
Even in schools, we have a quota, you know, we have quotas in the community for disabled children.
During this crisis, we must have had to allocate substantial financial resources to ensure safety of our staff and beneficiaries. How difficult was it? Did we have a fund for the rainy days beforehand?
Okay, this again, before the COVID, before the lockdowns and all happened in March, I wrote to all our donors saying that we will need some, we did not need extra funds, but we needed to reallocate funds. And I think they understood for PPEs, from their projects. So we allocated part of their funds, between 5% to 10% of the funds from each of the project, to ensuring that we had safety, security, and we could work in this way. You know, like we had to give telephone bills to many of them. So things like that we had to. So we did this before we were under lockdown. And I think the donors agreed by the time the lockdown happened.
Next question has three parts. Basically, the first part is how the COVID situation affected the climate resilience, and how Friendship ensured that the climate affected interventions were COVID proofed. And like many other countries, the lockdown facilities, the preparator of GBV gets closer together with the victims. So how did Friendship help in this regard?
The gender-based violence I can talk about, but Ramdad, you can talk about the climate, please.
Actually, I would remind and repeat the same thing. The whole world struggling with the COVID situation. And we struggle with the COVID, and plus recently we handled cyclone, and now preparing for flood. It's confirmed the flood coming within few weeks time. And the poverty overall, because more than 80–90% people, the daily wage earner, so that, you know, we can't give one direction. There's all the directions, the poverty, COVID, everything. So that first of all, we keep consider, you know, making people, you know, hygiene awareness. Actually, so we're providing hygiene kit, and we actually reorganize our program to make sure, you know, how they can within the, we distributed the seed. Husband and wife both at home at this moment, they started homestead gardening, so they can get access to the food immediately within few weeks time. So we just reorganize our program to make sure how best use we can best use that time. How can we reduce the trauma for children? There are huge expanded program we actually designed so that to make sure the competence, resilience, both working together. At this moment, assessment going on, we can tell you within a few weeks time, what are the houses, what are the villages will be flood affected severely. So that previous immediately will communicate government and the respective community leaders to make sure that these houses are vulnerable, this community vulnerable, that is will fall under river erosion. So that we can at least reduce the risk. We can't prevent flood, we can't prevent cyclone, we can reduce we can reduce the loss of assets, we can save lives. That's the way we work together for resilience.
And it's starting much early, not closing your mind into thinking it's not going to happen, or waiting for funds to come in, that when funds come in, we are going to start. It doesn't work like that. If you're not prepared, the funds are swept away, you know, because you cannot do anything with it. By the time you reach the food is already taken away by other organizations. So, you know, you need to ensure that you are prepared well ahead. And this is really, I think, we don't wait. We start and then somehow it works. Somehow, meaning, you know, I think we are prepared. We inform the donors this is going to happen. We take verbal commitments and we start, etc. And regarding GBV, we have a very big gender-based violence project, and I think we have done a lot of research on it, and also telephone calls. And we have got a research finding which we have done pre-COVID and post-COVID on gender-based violence from everything, for children, for male, for females. So, which of course we could send you the figures if you wish, if you just info@Friendship, and we could send you our findings. And we are on contact with over calls, and our field-based people are going there, and whom we are training daily. Online trainings are also going on with them.
Our bottom line, the hundreds of communities, they have no other choice except Friendship. So we don't have any chances to look back. Actually, we have to keep continuing our efforts, whatever resources or ability we have. Thank you.
Yeah, I think we would like to end. Sorry, William.
No, just a final point. I mean, it's because these communities and we are so much exposed that you need this level of preparedness. So it's not new to have this level of preparedness. And it's in this sense that there are lessons to learn from this level of preparedness for other countries. And I mean, you become innovative because you don't have any choice but being innovative. You are so well prepared because it's just a matter of life. So the level of exposure of all these incredible challenges in one single country with ultra poor situation is quite singular. But then there's no other option of being prepared. And this is where I think this model has to be shared, and thanks to you also.
Because, you know, giving is as much a responsibility as receiving at all levels. Donors give it to us. Donors have to be responsible donors. You know, they have to see that when we're asking something, it is real, and we will make so that strength I think we have when we approach donors. When we get to the communities, there is as much of responsibility that we have the way we give it. You know, if you see one of our pictures, if you see pictures from Friendship in a flood, so the community is on land, the Friendship staff are all in the water. You know, we don't allow the beneficiaries to come and take it from the boat. We are often in the water giving it to the beneficiaries who are in the land. And this, you know, this responsibility, it creates the root. So when we tell them something that do this, wear your mask, it happens. And I think we have been quite lucky with our staff who have been well protected, and even amongst our beneficiaries, they have been quite safe so far.
Thank you so much. We may still have any further questions, but I would like to end the session here and request you to kindly email us at info-bd. I have posted on our chat box. And with this, I thank everyone for joining us today. The session has been recorded and also posted on our Facebook page. You can also catch it up from there.